Okay, then we will begin. And again, for all the people who just showed up, I expected I'd be talking to one or two people today, and I don't know how many people we have, but I think we're going to end up with like at least 100 here, you know, crazy. But I guess this is a topic I talk to so many consultees about, and I'm used to talking about it. Let's talk about anxiety in general. Why the heck do we have anxiety? It's an early warning system. Something's bad. Watch out. Social control. Kids learn anxiety because I don't want to do the bad thing and have mom be mad at me. I don't want to do the bad thing and have everybody think I'm a jerk or whatever. Course correction. Oh, this doesn't feel right. Oh, right. I'm not on the right street. And kind of a safety monitor. Is everything okay? Yeah, okay. Or no, run. So we have it for a reason. It can be helpful. Um, Elaine Aron has written a couple of books about HSPs, highly sensitive people. These people, about 20% or so of the population, tend to be more reactive and responsive to the environment. Whether it's internal feelings, they just feel them more strongly than this big body does. Externally, anything that happens, the weather changes, there's a sound, but especially trauma, they feel it more. They tend to have lower affect tolerance just because they feel the affect so strongly that something happens and it's like, it's too much. Not all of them, but many of them are introverted. These folks are way more likely to be artists. Many are therapists. And they're more likely to develop any of the anxiety disorders because their bodies tend towards more anxiety, you know? So, yeah. Now, there's all kinds of anxiety disorders. Panic attacks, generalized anxiety. Panic attacks are when the breath comes in. Doug, you still letting people in?
Oh, right. I'm answering a bunch of emails, but let me get to this. Yes.
Okay, I'm
Yeah,
admitting some of
got
them.
it.
Okay,
Okay. Yeah, there's a bunch of emails now that I've got to attend to.
okay.
Yeah.
Panic attacks, generalized anxiety disorder just tends to be more alert to everything and more anxiety. Specific phobias. I can't get on an airplane, you know? They're not really allergic, but if I eat that, I'll die, you know? I can't leave the house. It's dangerous. I feel like I'm gonna die. I can't do it. The social phobias, which are often a social anxiety. Everybody's going to think I'm stupid. I'm going to screw up. I'm not going to go out there. I'm not going to speak in front of people. I'm not going to, you know, OCD, which we're going to talk about a lot today, obsessive compulsive. This is where the thoughts and the actions are repetitive. If I don't do this, a bad thing's going to happen. I got to think about it. I got to think about it. I got to think about it. And PTSD makes for anxiety. It's no longer considered an anxiety disorder as it was many years ago. And you don't have to have an anxiety disorder to have PTSD, but people with that anxious body are way more likely to get PTSD from the same event than somebody else. Not because they're stupid, just because it feels so strong. It makes such an impact on them. Okay. Some people are diagnosed with anxiety disorders and they may have them, but they may have different causes. Like If you're manic, it can go totally into anxiety for some people, aggression some people. And I had a manic boyfriend 35 years ago who it was just fun, fun, fun all the time. But it's a mobilized state that they have. People on the autism spectrum tend to be more mobilized and they tend towards all anxiety disorders because they have a more mobilized body. People with PTSD and DID can definitely have anxiety disorders that come from the bad stuff that happened to them. Um, People with attachment disorders, especially the ones who never felt safe at home, who didn't have a way to get calmed down, um, can have it. I had a guy walk into my office some years ago, and he just gotten anxious about everything all the time. Just, he never had anxiety before, but he was just really looking around and nothing bad had happened to him. I sent him directly to the doctor and I said, have him check your thyroid. They did. It was incredibly overactive and they needed to give him some meds to calm it down. It turned out it wasn't cancer, but he had a growth on his thyroid and they had to remove it or it could have become cancerous. But so just really watch when people walk in the door if what you are seeing, and you can have an anxiety disorder and have just about anything else in all of the therapy that we do. So, you know, it doesn't have to be this or that. It can definitely be other things. People in anxious states are mobilized. Stephen Porges, whom I adore, we've spoken at many of the same things, and he's a really good guy and a really smart guy who's done tons of research. He says that the big vagus nerve that runs through our body has three gears. One of them, I hope you're all in right now, reasonably calm, capable of thinking, capable of making decisions, of learning, of thinking somebody's cute, eating normally, falling asleep if I'm really boring, you know, just that normal state. Then there's the mobilized state, the unmyelinated ventral part of the nerve that has these three different parts of it. It's the red alert mobilized state. Scan for danger. Depending on the person, they can be in fight or flight. No, no. Can't eat unless they're eating, eating, eating to make it go away. Can't think about anything else but the distress. Can't do math very well, can't sleep. It looks anxious. Again, you can be in a mobilized state if you're watching that ball game and you're into it. Or if somebody really cute walks by. Yeah, you know, but um, a lot of times it is not much fun to be in that mobilized state. And it can be helpful if you are, I have never done this, if you are on the 25th mile of the race that you're doing and you're running out of energy, you can bring up that energy and push through and then end up in the dorsal vagal state right after you go over the finish line. The dorsal state is when you have 103 fever or when nothing is going well. It's down. Yeah. There's a bunch of vagal calming exercises. This one comes from Donna Eden. It's called Silencing the Alarm. If you all right now will think about the person you least want to run your country getting in charge wherever you live. Okay. In my country, that's pretty easy. Okay. Notice your feeling. Okay. 0 to 10, how distressed are you? Now, take your right hand and put it over your left eye. Push it hard over your left ear, behind it, down your neck, hit your shoulder, your elbow, and out the back of your hand. Now switch hands, right, left hand over the right eye, don't go behind your head, person. Go straight across your forehead to your ear. Straight across your forehead to your ear. That's right. Down behind the ear, hard down behind the ear, hard on your neck. There's a big vagal nerve right there. Shoulder, elbow out the back of your hand. If your arms are long enough, you can do it two-handed until the end, where you do this. If they aren't, one at a time. And while you're doing that, now breathe out all the way, all the way, all the way, all the way. Breathe in halfway. Breathe out all the way, all the way, all the way. Breathe in halfway. Breathe out all the way, all the way, all the way. Breathe in halfway, which, by the way, is how they help people who are having panic attacks. If they go into the ER, they'll have them do that negative breathing. It's the opposite of the that people are doing with a panic attack, and it really works. Also have them ground. Kyle Poon, who might even be here today, has a YouTube station called Calm with Kyle that has about 30 different ways to calm the vagus system. I taught him these two, and he went and took every training from Deb Dana and like that. Now, while I showed silencing the alarm, teaching pretty much this very class to about 1,200 people in New York City some years ago, Stephen Porges was speaking there too. He was in the front row, and he raised his hand and he said, Robin, I think you have that wrong. And I thought, oh, great. Stephen Porges is going to call me out in front of 1,200 people. I'm so lucky. I said, well, you better come up here and take the mic. And he did. And I said, what am I doing wrong? He said, actually, Robin, it calms the vagal nerve to do that. And I said, well, is that mutually exclusive? He said, no, actually, those Chinese medicine people knew something because I was explaining it as that kind of thing. And he said, no, that works that way. So I do have the stamp of approval from Stephen Porges on silencing the alarm. Okay. Those are the tools for labor. So the issues with anxiety, the beliefs, gotta run, we're all gonna die, I'll be out of control, everyone will think I'm stupid, the worst thing will happen, and then people with OCD tend to have the same thing over and over and over again, whatever it is. But it's just constant and they go over and over it. And the secondary emotional effects of doing it are shame for being so stupid, for being so crazy. Guilt for things that they messed up or missed because they couldn't make that. The worthlessness, which is shame. Fear of the fear coming up again. And if they had anxiety attacks with this, because it's not mutually exclusive, the PTSD from having been there, you can have PTSD from going through anxiety. Okay. So the behavior change often is the event, the arousal, the emotion, and then the thoughts interpret the arousal and the emotion. It must be this. And is it trauma or is it biology? By the time they're in your office, it's always both. Trauma makes anxiety, anxiety makes trauma. And it's traumatic and shameful for a lot of your clients. Now, for some people, they're taking medications. SSRIs can be helpful. Benzos can be helpful in the short term to calm it down. They're hard to get off of. They're highly addictive. Beta blockers can be helpful. Abilify and those kinds of drugs can be helpful, but often have really nasty side effects that last forever. You know, weight gain, um, just a minute, weight gain. Can you hear me?
Yeah, you're
Okay,
fine.
good. Okay, I thought I was letting some people in. I thought I hit a mute. Okay,
I'm handling that.
twitches, stuff like that. Omega-3s, which you can buy over the counter, often good to combat the inflammation that anxiety can cause. And there are different meds over the counters that are SSRI precursors that can be helpful for some people. How do you work with these people? Your therapeutic relationship has got to be good. They have to feel as safe as they get to feel with you. Social engagement reduces anxiety for most people, unless they had horrible parents when being close to anybody is dangerous. I sit close, I respond, I breathe with client. I don't laugh at them ever, but I try to get them laughing because they are laughing with me. Then they're feeling good. They're feeling calm. They can be in that place. So sometimes we're laughing at me, you know, and that can work pretty well. But really, and there's a lovely book by Rebecca Case about polyvagal informed EMDR. And a whole lot of it is about using your therapeutic relationship to help these people, distressed people, calm down. It's lovely. Um, so EMDR targets the triggers, external, internal, specific content, and this is for kind of all anxiety. Past incidents of anxiety attacks or extreme anxiety, traumatic incidents. I had a client who woke up in surgery and started having panic attacks since then, flashbacks. We got rid of it and they stopped having this panic. Bringing in the cognitions. I survived, I lived, it's over, I'm safe, I can handle it, whatever. Sometimes there's an anxious, dissociated part in your more dissociated people, people with rotten childhoods, often a very young pre-1 child with the experience of abandonment. Okay, guy, get his client, get his attention. Let's go back to where that kid was when he was so young. Get his attention. Now, pick him up, envelop him. Let him know that he lives inside you now. You'll never leave him because he lives in you. He's part of you. He's safe. You'll never leave him. He'll always have an adult, you present. He can't even leave you if he wants to. And if appropriate, like mommy never really left. She was just for good. She just had to go out and do that thing and then she came back. or she had to go to the hospital for 3 days. Remember that she came back? But this kid didn't remember that, so you're going to work with that. Her father never did beat you to death. It was scary. It was awful. Let's bring that kid up. And what I do now is I'll bring that kid up 6 or 7 or 8 times until there's none of them left back there. Okay? But doing the EMDR with these things and the decreasing arousal as a trigger. Just notice the heart rate, racing thoughts, muscle tension, and then have them accept the feelings, being able to name it, accept you're going to get anxious. And your job is to notice it. Yep, that's the kind of body I have. I'm in that 20%. It's going to happen, and have them imagine the different things that set it off and clear it out. You can even go after anxiety itself as a target and do current situational triggers, whatever. Public speaking, handing in a project, whatever scares them. And with their phobias, do their worst case scenarios. But before you do it, ask how likely they are. In one hand, hold how likely that is to happen. About 1 out of 1,000. In the other, how scared you are. 0 to 10. A 12. Let's clear out the 12 completely. Okay? Oh, I feel better. Now, given that you know it's highly unlikely to happen, let's imagine going into that situation and getting through it. What if you survive? Oh, okay. All right, cognitions, I'll survive, I'm safe. What if it works out well? If it's shame-based, I'm acceptable, lovable, good enough, even if I have an anxious body. Or I'm wonderful, even if that guy that I'm going out with that I've never met before doesn't think I'm a fit for them. Whatever, you know. For OCD and generalized anxiety disorder, the two-hand, how big the fear is versus the likelihood that it will actually happen. Okay, according to research with OCD, and I don't remember where I got the research, okay, but I've read this a few times. With OCD, what happens is the body gets anxious and the brain goes to what's the worst thing that could happen? Okay? Every time. And if they've done the same thought over and over, they're going to go right back to that thought. And so you're going to tell them your body is anxious, and so your brain comes up with this stuff again. What you're going to have to do right now is push that thought away, and that's after you've done the two-hand. The likelihood it's actually going to happen. And they go, oh, 1 out of 1,000. Okay. Versus the fear. Huge. Okay. So let's push that thought out and calm it down. But what I'm going to do first, the first round is EMDR with that huge, big fear. Just clear it out, clear it out, clear it out, and then go to the thought stopping. So imagine the next time you start going, it's going to happen, it's going to happen. Then you're going to say, okay, this is my body being anxious, and then those thoughts whirling. I'm going to push that thought. Some people like to pull it out of their heads, bang. Some people push it away. Now feel that anxious body. Yep. Now calm it down. you know? Now look at the thought. When your body's calmed down, oh, that's not so likely to happen. Some people, I might have them go run around the block, you know, let your body know you're running, you got away, but the grounding, breathing, relaxing, silencing the alarm, all of that, every time. Then take it to the future templates and have them imagine doing it in every situation. And some of the triggering situations are just going to be um, sitting around, and then the anxiety comes up, and then the thought comes up. Sometimes it's going to be the OCD of one of my consultees today said she has a client who has a woman who she's going to go out with the other women, and she's going, I'm not going to wear the right thing. Everybody's going to hate what I wear. Now, your friends don't care that much. I mean, yes, if you're going to a fancy restaurant and you wear a swimsuit, they'll think you're weird. But generally speaking, they don't care, or they shouldn't. But so have them, you've cleared it out, and then they're going to go out with the girls. And the thoughts are coming up. Push it away, calm the body down. And you might do some future templates with them around that kind of stuff. Like, now let's think about what color you feel like wearing the most. None of them are right, none of them are wrong, you know? But think about, yeah, what color do you want to wear? You want to wear pants or a skirt? How cold is it? Yeah, that'll speak to what you might want to wear. But yeah, and have them imagine other triggering situations and that fear and give them some good positive beliefs like people like me anyway, you know? Yeah. So I have this book I made of all the kind of visual aids. It's got the polyvagal nerve states in it, and it's got some dealing with, this is a page of it. When you have anxious thoughts, notice the anxiety in your body. Move the thoughts away. Notice the anxiety in your body. Ground yourself. Breathe into your belly and breathe out all the way, all the way. Look around and notice if you are safe. Yeah, nobody's trying to hurt me right now. Use the relaxation tools. There's a problem with this. I'm sure nobody's going to like me because there's a problem there. Okay, re-examine your thoughts as thoughts, you know, and go, yeah, that's anxiety. I'm okay, you know, but show them those tools. Outside of the office, there are apps. There's one called Calm that's very lovely. People can use. It has all kinds of meditation things, tapping, eye movements, butterfly hugs. If they aren't horribly dissociated with a huge trauma history and tapping works for them to calm down, they can use it. Running, eating well. Exchange the ruminating about things to practicing what to do to calm. Outside, don't let being anxious get in the way. This man who's helping me here and who spent about 7 or 8 hours organizing all this when all of you people decided you were going to show up. Uh, he is one of those bodies. He's in that 20%. I've seen him be terrified to get on an airplane and get on. He has gotten on helicopters. He's a photographer. He's gotten on helicopters and hung out the door to get good pictures. I have not seen anxiety stop him. And that's been helpful with my clients that who get stopped all the time. I don't necessarily talk about my husband with them, but again, imagine being anxious, future templates on being anxious and doing it anyway. Ask, how likely is it to happen? 100%, 2%, 0.002%, and get these people connecting with other people who are more relaxed. You know, if they have a critter that's relaxed, if they have a partner that's more relaxed. Some people have trouble with that, and I will create with them a circle of love. It goes like this. Think of all the people who love you where it hasn't gone bad. They don't also like beat you up or stuff, something like that. You can even put some people in that circle who have passed on if you still feel connected with them. I have 2 of those people in my circle of love. If you have a good connection with a loving deity or the Buddha or somebody, you can put them in. If it's a mean one, but a loving one. If you have a dog, definitely put it in the circle. If you have a cat, if it's exceptional and loving. Okay? Autumn's kitty can be there. Okay, that's a loving cat. Okay, so I want you right now to look around that circle one by one and feel the love come at you from this one and then let it bounce to them and bounce back to you. And then go to the next one and let it bounce and go around that circle. I'll give you a few minutes sending the love back and forth, bringing in the love. That's right, with each being in that circle. And with your clients, you will know some of the people to suggest. How about your sweet husband? What about that doggy? Whatever. Yeah. Now, if they've got a rotten childhood while they're doing this, and you can do all this right now, bring that love in from that first person. Now send it down to that little kid in you who didn't get enough of that when they were little. Send it to that baby. Now send it to the 2-year-old. Now send it to whatever. So you can do that. And it tends to be really calming. Yeah. So it's a nice way to do that, and it tends to calm people. Oh, panic attacks. This is very quick. After clearing the past traumas and what if it happened now, use the future template. Have them imagine doing the negative breathing, exhaling all the way, all the way, all the way out, breathing in halfway for at least 10 breaths. They could run in place, tricking the overactive fight or flight response into thinking the client to escape. Silencing the alarm, I showed you that. The butterfly hug, telling clients to stop if it brings discomfort. Challenge the irrational thoughts to go with the panic by saying, I'm going to survive this. This is my body overreacting. It's panic, not death. I'm saying my body is just having a fit. This will be over in 5 minutes if they do the negative breathing and this. Yeah, that's just quick. Oh, okay, here's my OCD stuff. This is weird. I was bringing in another workshop, so let me just go over this again. We have plenty of time. In OCD, in one hand, hold how scared you are about the thing happening. In the other hand, hold how likely it is. Slow eye movements with that. Then clear the fear with the EMDR 2.0. Does everybody know 2.0? It's this. You add this, fast eye movements, this. I have them stick the tappers under their legs while they're doing it so that I have another one and maybe even spelling words backwards while we're doing this. And then going back to the fear and then doing it some more. It's amazing. Just add the eye movements, do everything. Okay, let them know according to science, the fear comes first in the thoughts. Now let's think about the next time these fears arise. Stop the thought, push it away, feel the fear and calm your body. And do the future templates with all the likely intrusions of the thoughts. Repeat it with each kind of OCD thought. That was interesting. I thought I put this page on and I didn't. The positive cognition. This is just adrenaline in my body. My mind confuses it with germs. The negative cognition, I won't survive. The positive cognition, my brain is lying to me and I'm just fine. Asking the client to give up rituals sometimes is like asking her to give up herself or her safety. And I have a sentence for that. OCD is something you have, it's not you. So the client is saying, I can't deal with this anxiety. I'll translate this fear into something I can handle. I'm afraid of AIDS. So if I wash my hands 50 times a day, I'll be safe. And actually, you don't have to. You don't get it that way. And now they have drugs for it. But, that kind of stuff back there. Block the ritual. Here's a good target. I learned this in somebody else's class at an EMDR conference years ago. Think about that you touch that dollar bill and there's no way to wash your hands. But if I touch money, I have to wash my hands. It's going to have AIDS on it. Or now it's going to have those new diseases that are coming around, COVID, RSV, all of those. Get all the feelings and do the eye movements, do the 2.0 with it. If such and such happens, I have to put toothpaste on my tongue or I'm going to die. Again, you can't do it. Block the rituals. What will happen if you can't do it? I'm going to die. Blah. Repeat what they say. Keep them at that optimum level of anxiety. Don't run from the affect. Focus on it. The client has spent her life trying to control affect with her compulsive behavior. Use eye movements, all of this, and then later relaxation, breathing, grounding, and containment to move it along. You can block the ritual with cutting. Imagine you have that feeling you have to cut, you have to cut, you have to cut. That's an OCD response, by the way. And you can't. What feeling comes up? What are you saying to yourself? With throwing up, with hair pulling, with too much TV, with any of these things, whether you call it OCD or not. But a lot of this stuff, I have to do this, I have to do this. So you block all these things they're doing, do the EMDR, calm the body down. Imagine the next time they want to do it, they need to name the anxiety as anxiety, push the thought that they have to do this stuff, push the underlying anxiety thought away, and calm the body down. Calm the body down. Calm the body down. Feel everything and know what's truly safe. Let yourself feel everything. Okay? Are there questions?
That there are. Take your undo your screen share. I can call in people for you.
Okay, before I do that, I want to say you are all, whether you like it or not, going to get put into um, um, a Zoom list for my open consult group. That it's Friday, 1:30 to 3:30 Pacific time. Here are the dates. It's monthly, except not in 2 months. And it's 25 minutes, 25 bucks if you come. There's no commitment, and you get about 10 or 15 minutes. And I have 20 other groups, but there's about a 15-person waiting list for those, that one, all of those. So just so you know. And then there's a bunch of other stuff here. Okay,
We
so
have
I am
questions coming up in the chat. That might be a good place to start with them. Someone wanted to know about pairing earlier on, about pairing tapping with, oh, where'd my chat go? Box go? It went away. Blah, blah, blah.
it's on the bottom of my
There
screen.
we go. I found it. Yeah. Would you pair tapping with the circle of love exercise? Um,
What slow tapping in? For me, I believe if it's good stuff, you're going to tap it slowly. If it's bad, oh, can I put up the last slide? You should have the slides.
yeah. Okay. I'm going to go down the list here. Can you do the 3-minute, what is EMDR 2.0 version of it?
Yes. All right. It is taught by Ad DeYoung, and he does it. He has people come to this. I think they come for a week, or 3 or 4 days at least, and they have 7 different sessions a day with different people doing this. But it works to do it. The rest of us have figured out. We just do it with our clients. So you've got a trauma or a big bad feeling. You set it up, and what Ad DeYoung says to people, we're going to have a competition. You're going to try to hang on to those feelings. Um, I will put the slides back up in a bit. You're going to try to hold on to those feelings, and I'm going to try to get them away from you with all this stuff. Okay? So, what I have people do in my office is stick the tappers underneath their legs, put on the zzz, zzz in their ears, turn them really fast, do fast eye movements, have them be doing this and stomping at the same time. And then I might ask them, now, can you spell alternation backwards? I'll have a page with big words on it. And while they do that, they're doing all this stuff and then take them back to the target. Now notice the anxiety about whatever, and then, and notice that in your body. Yep. Okay. Let's start again with everything. And you do that. It is very, very hard for your dissociative clients to dissociate when they're doing this. There's people nodding. They're doing it. How many people are doing this? Yeah, a bunch. Yeah. It's very hard for your clients to dissociate when you're doing this. It's it's amazing. And it's sort of fun.
Okay. Rachel has a question about how to work with primarily mental compulsions. I'm not sure I know what that means. Rachel, why don't you speak up and
Raise your hand, Rachel, and we can get you
there you go.
speaking. Raise your hand.
Yeah, we got her. We got her.
Okay,
I'm here.
great.
Yeah, what do you up you froze.
Hi, Robin.
I can't hear you. I can't.
Rachel is freezing. I
First
don't think she has a
of
good enough
all,
connection. Let's go on to the next person. Diane has a question
but
about
a
the structural.
lot, the two clients that I work.
Oh, she's not
Rachel,
responding. Let's go to the next one.
write it in the question.
Yeah,
Write it
yeah.
in the chat. We'll get back.
Okay.
Right.
Let's
I'm
see.
I'm ready.
Diane, yes, go ahead.
I'm ready. So I just saw my OCD client and we've talked about her before at on the Friday conferences. She decided to try to go off her Prozac a little bit. So it's been reduced from 40 to 20 and she's not feeling great. So she's going to give it a little while and then possibly go back up. But we had kind of an interesting conversation. She went to Mexico last week and she was like at an all-inclusive resort with her family. She's married. And at the end of the week, her husband said, you know, you're doing really good. And she's like, what are you talking about? He's like, you're OCD. You haven't, she checks when she drives because she feels like maybe she ran something over. And when she parks, she checks under the car, in front of the car. And then she checks cups when she pours coffee because she thinks maybe there's alcohol in them. So I guess when she was on this all-inclusive vacation, she was fine. So I'm wondering, like, I know. So does structure and routine, and when she drives home, like when she goes up her driveway, she always feels like she's hit somebody. But her street's been under construction, shows has have to go a different way, and she's fine. So like changing the routine
Yes.
or the
Changing
structure.
the routine can be helpful because it's tied to doing the same thing
Okay.
for some people. Other people, they're going to make it about anything, but a lot of
Okay.
times it's very habitual.
Okay. Yeah. So, okay, good. She was going to the grocery store and I said, well, however you put your groceries in the car, let's try and do it different. And then maybe you won't have to check like that you put them. So we'll see what she comes up with next time. But I just wondered if the structure is, you know, associated with the checking.
Absolutely.
Okay, cool. Thank you.
Absolutely. Yeah. Okay. Rachel Garner wrote me a note. Working with two clients whose main compulsions are primarily mental checking. What if I get sick? Let me review the likelihood that I might actually get sick. Let me check mentally for symptoms so that engaging the rationality of the content of the section is actually counterproductive because it's a compulsion ritual itself. How do we help clients like this to steer away from engaging with this while asking them to notice the fear? Rachel, tell them to tell the language to shut up. I'm not dealing with you. I'm not dealing with you. And just push it away. Push it away. And that's what you do.
Okay, we've got one from Heather Morgan. techniques, using the same technique with BFRB. You may know what that acronym is. I don't.
I
Maybe
don't. What is it?
Heather, chime in.
Sorry, I had to unmute. Body focused repetitive behaviors like hair pulling and skin picking.
Oh yeah, I talked about that. Yeah, just every time they want to do it. One of the things that I will do with that stuff is the deter protocol. The deter protocol, which is about addiction, because that stuff becomes addictive. So when you, whatever the trigger is to doing it, whatever the trigger is to doing it, how good would it feel to pick, to hair pull, to throw up, whatever their thing is. And how good would that feel? 0 to 10. Oh, a 10. Great. Now, what I do before I do EMDR 2.0 on that is I'll say in one hand how good it feels, in the other hand, the ways that it's not good in your life. And usually, yeah, now it feels good, more like a 6 instead of a 10. Okay, but it still feels good, a 6. Feel that 6, throw 2.0 on it. And then when you get it knocked down, go to the trigger. What is the feeling? That's the trigger to doing this, any addiction, but doing this stuff. How do you want? Let's use, if it's anxiety, let's calm it down. If it's shame, let's do some therapy on it, whatever it is. Okay. Another question?
We've got a long one from that just showed up from Drew. I haven't read the whole thing yet. Drew, why don't you chime in and say what you're asking here?
Sure. Yeah, thank you. So I may not understand OCD well enough, because I'm a little confused. Um, on one hand, I'm trying to understand how it could be like parts that developed OCD as a way of finding control and being compassionate and understanding with that, but also telling them to shut up. So I'm confused.
Okay, I do not see OCD as parts work. And
Oh,
I teach ego state therapy. OCD occasionally it's a part, but usually it's just like a bad, it's just the thought comes in, the thought comes in, the thought comes in, the thought comes in, but it's not a full-blown part.
oh, okay. Thank you.
That
I
was
think
easy.
there's
Thank you.
Nika's question as well. She had pretty much the same question, so I think that might answer that.
Okay, we'll skip that. All right.
Yeah. Okay. I think we've caught up with everybody who wants to chime in, I think. No, Christina just said something. Yeah,
Okay.
look at Christina's comment.
Would you spend less time in target sequencing and resourcing for OCD and move more quickly to processing phases? Oh yeah. I just go after it. In one hand, hold the huge fear. In the other hand, hold the likelihood, and then just go after the fear. Bang. Where do you feel it in your body? How big is it? Go. Okay. So I don't do the whole, 6 weeks of EMDR setup. Okay. Now, a couple people wanted to see some of the PowerPoint again. Doug?
Yeah, well, I see it, or I will, if I can resend it to everybody just to make sure you have it if you didn't get it the first round. Um,
Are
everybody-
there particular questions right now about it? And I can stay a couple minutes late. I'm done for the day. Yes, the two-handed interweave. Yeah. Can you share maybe real quick about consultation opportunities you offer? Yeah, I do individual consults all the time. I have like 8 clients weekly. I do 4 or 5 consultation groups a week. But again, there's a waiting list. There's 4 people in each group, and there's a waiting list of about 15 people for that at this point, if you want to get on those. And those, everybody gets a half an hour. You have a 6-month commitment, and it's $85 a session. And you, it's $85 a session, and you pay whether or not you come. But if you miss, other people get your time. If they miss, you get their time. There's an open group that I sent the dates out for. And in that open group, and you can show up or not. It costs $25. You get about 15 minutes. Heather? Somebody, I don't know what she's, and there were some things in the chat. Can you talk about OCD and extreme self-criticism? Yeah. Sometimes that can be OCD, and you can push it. You can push it away, and you can go to the underlying stuff. Now, if the criticism, for instance, comes from the voice of their mom or dad who was critical all the time, I'm going to do a momectomy. Where in your body do you carry your mom's critical voice? Right there. What color is it? Oh, it's black. What's it made out of? People always say goop, like black goop. And I'll say, do you want to keep carrying that voice around? You can still love your mom, but do you want to carry her critical voice around inside of you anymore? No. Take this shot back. Okay, turn it on. Get it all out. Get it all out. Get it all out. Okay. And can I talk more about not viewing OCD as a part? It can become a part maybe after years, but it's really more, it's a reflex. It's a reflex, not a part. And yeah.
If I'm going to scroll up, there's some comments we didn't cover. Scroll up a little bit. There's some things we didn't cover. From Mia Fine, as a sex therapist, I've used FSAP for clients with OCSB, out of control sexual behavior. Could this protocol all work for OCD compulsions?
It can, but you have to start. I would do the level of urge to act out sexually, out of control sexual behavior. But could this protocol also work for OCD compulsions? Yeah. If they're saying, I have to do this, I have to do this, I have to do that. In these cases, sometimes it is a part. And you need to go get the adult in charge. In these parts, in these cases, it could absolutely be a part. So check that out first. Yes. And I'm referring to the two-handed interweave when talking about putting things in each hand. Okay, what about when a bad thing that they're worried about is a high likelihood? How likely is it to be happening right now or at any given time? That's low. Do you want to go around, client, in fear every minute that that's going to happen? No, but what if it does? So let's imagine that it does and do EMDR on that, because it's not very fun with the kids puking. Okay, now I want to show you all something. This is one of my favorite things. Everybody, please stand up right now. Stand up, all of you, if you can. I don't have to see you. Stand up. Now, tighten up your body. Put your shoulders up by your ears. Tighten up your belly. Straighten those legs out. Put your arms, make fists. Okay? Now, look around to see if you're safe. All right? And you're ready for things. Okay? Now, punch out. All right? Now, drop your shoulders, shake those arms, bounce down into your knees. Breathe out all the way a couple times. Now, look around and see if you're safe. Okay? Now, punch. Okay? Have a seat. Under which condition, one or two, are you actually more safe? Put your fingers up, one or two. Yes. And you can tell your clients according to I love David just had all these balloons go up. According to every martial arts trainer in the world, what they do first is teach you how to relax before they teach you how to fight. And according to the polyvagal theory, which I'm always showing people in this little book, you know, when you are mobilized, you can't think very well and take care of stuff. When you're not mobilized, you got your whole brain. So you can be worried about them puking all the time, or you can be calm and able to respond lovingly to them. And if they puke, you can help them clean it up, or you can clean it up, you know, because what are you going to do? It's a reality. Shit happens. But you can either go around like this all the time, or you can be like this, and when shit happens, deal with it. But it's very powerful to get them to stand and tighten up. Very powerful. Yeah. Okay, any other? Oh, there's some new messages, 6 new messages. Okay, I think that's it. We're good.